Hi, I'm Elliot Froman, Director of the Multiple Sclerosis Program here at the University of Texas Southwestern Medical Center in Dallas. Over the last 8.5 years, we've been focused on the development of a comprehensive center for the research and treatment of multiple sclerosis. I hope you'll join me on this brief tour of our center and have the opportunity to see the kinds of things that we have brought to the clinic to enhance the quality of care that we provide for our patients. Thanks. Our group is comprised of some 50 individuals, including physicians, scientists, nurses, physician assistants, social workers, neuropsychologists, and imaging physicists. Our research has been principally focused on the neuroimmunology of multiple sclerosis, and I'm joined here at the center by my colleague, Dr. Michael Racky, who is director of the Neuroimmunology Research Program. In addition to Dr. Racky, Dr. Nitin Karandikar, a member of both the Department of Neurology and Pathology, is focused on understanding how T cells and other elements of the immune system participate in the disease process. Dr. Nancy Munson directs our B-cell immunology laboratory effort here, trying to determine the role that antibodies play in the disease process of MS. We've been very excited most recently by the development of our Multiple Sclerosis Southwestern Center here on the campus of the University of Texas. This center includes approximately 6,000 square feet of space, multiple exam rooms, a 4-bed dedicated multiple sclerosis infusion clinic, and an on-site case manager and social worker to help facilitate the best possible care for our patients and families with multiple sclerosis. One of our goals has been to integrate a diversified range of services in one clinic setting for our patients with multiple sclerosis. Currently, we're here in the bladder and bone lab. Here we'll have the ability to do sophisticated bladder studies for our patients who have MS and bladder dysfunction, and also bone densitometry evaluation to look and determine whether our patients have any evidence of accelerated bone loss, such as osteoporosis. We've been very interested in eye movement abnormalities in MS, primarily because we think that these may represent target syndromes from which we can look at the ability of stem cells to promote recovery or restoration of function in very specific pathways of the central nervous system. In our lab, we've been principally involved in characterizing particular kinds of eye movements in multiple sclerosis and then looking at the relationship between the physiologic abnormalities with imaging abnormalities on sophisticated MRI techniques such as diffusion tensor imaging and magnetization transfer imaging. We're now in the multiple sclerosis chemotherapy infusion clinic. Within the clinic, we have 4 beds dedicated to infusion therapy for patients with multiple sclerosis, and we also employ a chemo-certified nurse. We continue to be excited about the prospects, both present and future, for enhancing the kinds of things that we're going to be able to do for patients and families with multiple sclerosis. It's a very difficult disease to deal with, but I think the future looks incredibly bright.